I want to take a moment to welcome our guest today, Dr. Russ Ronson from Baptist Healthcare. I want to recognize that Baptist is a tremendous partner to both the University of West Florida and also the Usha Kundu MD College of Health, and we're so lucky to have you with us today. So maybe we could start with you just introducing yourself to our audience a little bit about your background, maybe what drew you into medicine to begin with, and then what your specialty is and what you do at Baptist Healthcare.
Well, thanks, Dean Bellar. I appreciate you having me here. I really enjoy these times that we get out in the community and meet with folks. So my name is Russ Ronson. I'm a cardiothoracic surgeon at Baptist Health and Baptist Hospital. I was originally born in New York, raised in Texas, went to medical training all over the United States, from University of Texas to Dartmouth Medical School and Emory and University of Virginia for some postgraduate training in heart disease. I can tell you that I wanted to be a doctor for as long as I can remember. However, I didn't always want to be a cardiac surgeon. That happened later in life. I always emulated my uncle, who was a physician and an orthopedic surgeon, and that's what I wanted to do. I was a huge Pittsburgh Steelers fan back in the day, and sports injuries, and that was what I was going to do. However, as time went on, and I started to be in the hospital and go through med school and follow around certain physicians, I realized that orthopedics, while incredibly important, didn't have stethoscopes or lab values or anything outside of the specific scope of practice. So I decided to go the general surgery route and become a general surgeon. Well, shortly after being in general surgery, the people and the system and the dynamics of heart disease and the prevalence of heart disease drew me to cardiac surgery. So I've done that for the past 25 years. I feel very lucky to have wound up where I am, and there's never a shortage of business in America for heart doctors. So that's how I got here.
Well, thank you for sharing that. Hearing those narratives for our students is incredibly impactful, and that you found your way through and found your passion as you continued your course of study. I mean, those are the same messages that we like to send to our UWF students here, is to follow their passions and be true to them. So, saying that you don't have a lack of business leads nicely into the next question, because in one case, business is good. On the other case, that may say something about our society that's maybe not so good. So we asked if you could talk a little bit about maybe why is heart disease the #1 killer in the U.S. And what are you seeing, and what do we need to be paying attention to and doing differently?
So cardiovascular disease not only is the #1 killer, it engulfs all other diseases that we have in America, and it's certainly multifactorial. Every country, every continent sort of has their disease that plagues them, and cardiovascular disease is ours. It's a combination of things we can control and a combination of some things that we cannot control. To take a short time on what we cannot control is our genetic makeup, our genetic gene pool passed down from generations is not favorable when it comes to cardiac disease and vascular disease. Now, that's not to say everybody has bad genes, but it is one of the things. We do not process some of the cholesterol, some of the other foods that we eat quite as well as some other genetic pools. So you can't run away from your genes, I always tell my patients. However, then there's this huge bucket of things that we can control. Things like diet. And even our good diet in the United States is not nearly as good as some other countries. Most of us, even if we are eating well, are not catching our fish and cooking them right there and eating them before they've touched lots of different processing. Even our vegetables, most of us don't eat all of our vegetables out of our backyard. However, that's the best we can do in our society is watch what we eat, watch the number of calories we eat, watch what calories, and you can get on any internet, any blog, any commercial while you're watching a team talking about heart healthy diets, low in fat, low in processed foods, lower in carbohydrates. There's lots of ways to go about this. Secondly is our activity. We are, as a whole, a lazier society than a lot of other societies. Most of us don't walk or ride a bicycle to work. Certainly, plenty of people do, but as a whole, our highways are filled. We are not climbing mountains as a general rule like many other cultures do. We don't take hikes nearly as much. We are just not as mobile a society as many other societies. So keep moving, eat the right things. And if you drive down North Davis Highway or any others, every other store is a quick and easy way to eat food, which contributes tremendously to our poor health, our obesity, which is really a crisis in America today. And we don't talk about it quite as much as we should in those terms. So you pile mediocre genetics from this particular standpoint with a relatively sedentary lifestyle with the diet that we are exposed to, and you sort of have this perfect recipe for cardiovascular disease.
So let me ask you a little bit about when is this detectable in people, and what do people need to be doing in order to have appropriate knowledge? Because I know that there's some components of this that people may be walking down the street and they're unaware that there's these physiological changes that are occurring within inside them, and they're moving towards heart disease. So how do we check in on ourselves?
So it's a great question. So cardiovascular disease begins when we're born. If you look at the inside of the blood vessels of some folks that have what we call premature, in other words, you're not 60 or 70, you're getting disease earlier, those plaques are laid down in our teens, in our 20s. So just because somebody feels well or is not having stereotypical chest pain or arm pain or shortness of breath does not mean that this process is not going on. This is a lifelong process. What I like to say, so every day I hear, but I feel fine. Mm-hmm. That doesn't mean your blood pressure is not high. That doesn't mean your cholesterol is not high. And what I like to say, and I'll explain a little bit, is what we do is acute discovery of chronic disease, meaning we are discovering what has been going on chronically for a long time. That doesn't mean it wasn't going on. So the best advice that I would give is to start early, understand that these changes are coming as our life goes on, and when it's appropriate, depending on your genetics, depending on your health and your weight, you need to interact with your physician as to when do we get stress tests, how do we measure our cholesterol, and how often we follow that up. When do we get other exotic tests like calcium scores and things like that that are in the news that give us some idea that we are having this problem before we have a problem.
So let me ask you another question, because there's more devices now, electronic, mostly electronic.
Yes.
And so my opinion, those obviously are not ever going to replace a practitioner like yourself. Right. However, they are giving a lot of people information and data. So maybe you could elaborate a little bit on what role you think these could play, don't need to play, where they fit in this
Great
picture.
question. So we are in an era where we are steamrolling through technology and what is available. And I mean, I have a watch that tells me my heart rate, my heart rhythm, my oxygen saturation, and a whole lot of other things, blood pressure. And I do think that those are important, and those are going to get better and better and better. I think what those in today, in 2025, I think that those are good cues to seek an opinion from your regular doctor, from a cardiologist, from your medical health professionals, to that, hey, you know, I see my heart rate's 120 and I'm sitting down doing nothing. If you have something that takes your sugar, I notice my sugar. So I think we are mostly in the detection stage of technology that is incredibly useful and may give us hints and clues that we need to further investigate something and prompt us. Again, the name of the game, as we mentioned earlier, is early detection and doing what we can do before the problem starts. So I think we're in the early detection phase of AI and Grok and all of these other tools that are really coming out at an alarming rate.
So I guess if you could maybe give us just some quick points on, because again, those devices are now everywhere, as you were mentioning. So if you were going to talk to the audience and say, the devices mostly can do this, what should somebody be paying attention to when they're looking at that? And then, if they were to trigger a desire to go talk to a GP or or somebody like you, what information would be valuable to share out of that?
So most of the simple devices that are out there will do heart rate, blood pressure, and oxygen saturation, and they will alarm you when those are abnormal. And I do think that if they are abnormal, other than if you're going for a 5-mile run, and I do think that is worthy to convey to your practitioner. Now, there are more sophisticated devices that will tell you your heart rhythm. And if your heart rhythm is being flagged or notified, that is certainly a reason to prompt discussion. And really just write down or record or put a note in your phone as to what you were seeing, when you were seeing it, what you were doing, and what the device told you. Really, if from this side of the exam, if somebody comes in and says, well, I was watching TV and my watch told me that my heart rate was 112, or I was in an abnormal heart rhythm like atrial fibrillation, that's incredibly good knowledge from my side to know where to start looking.
Okay, wonderful. So maybe let's shift gears a little bit to the preventative side of the equation. And I understand the genetics were sort of dealt the hand that we're dealt. But I think, oftentimes in some of the conversations we have here in the community and elsewhere, we talk a lot about trying to maximize the number of healthy years of lifespan that we have, knowing that we have a finite lifespan, trying to make sure that we can live 80, 85, 90% of that in a state of health rather than the last 20 years in a state of declining health. So in terms of physical activity, maybe we can start with that. What's the minimum that you would recommend people start trying to do? What's the minimum that would get them some health benefit, and then maybe what's the optimal?
So everybody falls into a little bit different categories to what they are capable of. What I say, again, on a almost hourly basis is keep moving. Whatever that means for you, keep moving. Walk down the road rather than taking a golf cart down the road. So that would be what I would consider the minimum. Take the flight of stairs up, the couple of flights of stairs down. If you have a office job where you are primarily sitting, make sure you take your break and you are moving. So walk around the store, park further away from the front door, but really get in the habit of moving all the time. The optimal amount that you can do is at least 30 minutes of elevated heart rate exercise is what I like to call, because that is different for everybody. Some people can run fast, some people need to walk on a treadmill, and all of that is fine. But what you want is to get your heart rate elevated for a minimum 3 times a week at 30 minutes. More than that is better, but that's really from an exercise standpoint. You also never want to do one specific type of exercise as your lone exercise. You don't want to only do strength and conditioning. You don't want to only do running. You would like to have some mix of, because as we know, if you're a runner, which is fantastic, eventually your knees and hips will catch up to you. And if you have something else to do that you can morph into or give your body a break, that's all. You're talking 5-star gold reviews. That would be the best. And then diet, in terms of prevention, we talked earlier about that. But really watching how much and what you eat. And I always tell patients everything in moderation. It is not that you can never have a McDonald's cheeseburger. It is if you have a McDonald's cheeseburger 4 days a week that becomes the problem. So balance to keep sanity, which is again different for everybody. But if you can keep moving to the best of your ability for whatever age and activity level you can do, and you can balance your diet and really be cognizant. I mean, now every single piece of food that you pick up has the dietary information on it. We have made it as easy as we can without eliminating supersize. Balancing that would really be, and the earlier you do it, like we said, this is a lifelong disease. This is not, I woke up one day and this was here. This started a long time ago and came. So the more you can do that, the better you can do that, the longer healthy years you will have.
Wonderful. So I know some people are concerned when they know that they're not in a good state of health about are they safe to start what you're talking about, just moving more, being more active. So what would be the best approach for them in terms of assessing are they ready to engage in some of these behaviors?
So I would always talk to your medical professional, nurse practitioner, physician assistant, general physician. If you happen to have a cardiologist, always say, hey, I'm gonna start doing something. However, what I would suggest is unless you are having chest pain or some active problem, start to walk. But you don't have to walk far. Walk for 10 minutes. Do that a few days a week. Then walk for 12 minutes. And then before you know it, you're walking for a half an hour. So if you have any questions about your own particular health, I would talk to a healthcare professional. Say, hey, I'm really concerned because my heart rate is up on my watch, or I sort of get this indigestion, chest pain, those conversations need to be had. But if you are just haven't done anything, I would start to walk. That would be the first thing that I would do.
So no fancy gym membership, no special
equipment. Not needed to start. Now, I'm not discouraging that by any means. And if the treadmill is more appealing to you, then sure. But I don't think that is a necessary component of keeping moving. I think you can do this for free.
So I agree with that. I think so. You know, I'm an exercise physiologist by training.
Oh, okay. Well, you're better at this than I am.
Well, no, I think it's good to have that, that balanced conversation. But I mean, one thing that I think, we know is if we just go out and buy a fancy exercise bike and hop on it, we tend to not feel very good at all when we're done, right. And then that, doesn't help people continue the behavior.
For
but
sure.
Everybody can walk and generally feel better after the walk than they did before. So
and be precise about it. I am going to walk for 10 minutes. have a plan. And I think that you will feel better and feel like you've accomplished something.
Especially if that plan is realistic. 'Cause
Correct,
starting off
100%.
with 10 minutes is something that's pretty much manageable for everybody.
Right.
But a lot of times when we talk with people, it's they want to jump in and I'm going to start walking an hour. Well, that maybe isn't the best choice for you.
I would start and accomplish, and that will help you accomplish other things.
So maybe let's shift gears again and talk about the other thing that people typically view about themselves and have sort of some thoughts about their health, which would be their weight. We know this one's sometimes harder to modify than walking as a behavior. We can go out and do that. And we know that our society on the whole, we're seeing prevalence of obesity and overweight, particularly in the area that we're in here and other
100%.
areas that are located closely. So maybe you could talk with us a little bit about that, the role that might play in cardiovascular disease.
So obesity is an epidemic in the United States. We are certainly when it comes to body mass index and things that we measure, we are on the highest of the high compared to the rest of the world because of a lot of the things that we have talked about. The same things that cause obesity cause cardiovascular disease. It is not per se that the obesity is causing the disease, but the same sedentary lifestyle, not a specific diet, even to some degree genetics, but less so, cause both of those things, and they come hand in hand. And certainly, if you are overweight, you are more likely to have cardiovascular disease. So the same management would apply. Now, we are also in an epidemic of GLP-1 inhibitors, and that then becomes, I do not ever recommend anybody to go down to their local corner store that happens to have it without an exam, but if you give me X amount of dollars, we will give you this and you will lose weight. That is not that's not going to be a long-term solution, and it's not, in my opinion, an overly safe solution. I would have those conversations with your, again, healthcare provider, whoever that particularly is. I do think that those have a role, and sometimes those can be a Kickstarter to start other behaviors. Well, I feel a little better. I'm now going to walk. And the reality of it is, we don't know 10, 20, 30 years down the road with the GLP-1s and like medications. We're not sure what the data is going to play out as to how many people were successful, how many people achieved what they want, other than going and buying a smaller pair of jeans at the mall. So those discussions are a little bit more complex, and I have tons of friends and people that we know that the only goal is to lose the weight irrespective of its health implications, and I think that's not the smartest way to go about it.
And I guess on the flip side of that, is it possible for somebody to change their behavior and actually attain a better state of health without seeing much of a movement on a scale?
It is. If you are moving and exercising, but your weight is not coming off, number one, that's another discussion to have to make sure there's, thyroids and other things that may not be playing a role. But if you are lessening your resting heart rate, if you are increasing your endurance, if your metabolic processes, the way you're processing insulin and sugars, because you are moving more and exercising more, you can do that without shedding 30 pounds.
So the other thing that we tend to see that gives, I think, some, people pause is we'll see athletes, marathon runners sometimes that end up having cardiovascular disease. And those two things sometimes I think they give people challenge in their mind as they try and wrestle with that thought process. So maybe you could give us some insight into how something like that is possible.
So athletic cardiac disease is a whole subset unto itself. There are plumbing issues, which is the blocked arteries and the heart attacks. And then there are electrical issues, which is how fast the heart beats and what heart rhythm you're in. So just to quickly say that a number of athletes that have cardiac disease have the electrical kind of disease that is really of nobody's fault per se, but significantly there are diseases, Wolff-Parkinson-White syndrome, that a lot of young athletes turn out to have that can cause abnormal heart rhythms, and others that are not really what we are talking about, but fall into a generic heart disease basket. Now, there are others that are in incredibly good shape, can run very far. However, their genetics are not what they are. And what is processing cholesterol to me, if my normal number for a mid-50-year-old person, I want mine around 150, say. Well, 150 to me may be fine, but 150 to you, because you're not breaking it down properly and putting it in the places that it needs to go, may be way too much. So even if you are running and you are healthy, you can't outrun your genetics, so there's a genetic component to that. The other component is, this is a whole long discussion that we could talk about for a long time, but the other component is a lot of athletes, a little bit less the runners, a little bit more the football players, and more of the strength conditioning sports. The heart is a muscle, and that muscle can get thick the same way that any other muscle can get thick. And when your muscles get bigger, they require more oxygen. So while somebody may have a normal thickness and a little bit of disease that doesn't bother them because they're getting enough blood to their heart, somebody who has a big heart or a thickened heart from either excessive weightlifting or even medications or excessive bodybuilding training, even though they have what would be considered mild to moderate disease, for them it is significant because of the amount of blood required to keep your heart functioning properly. I'm not sure I said that well, but so there's lots of variability. That does not, those are sort of, that does not change the general principles that we are talking about. Look, you can do everything right and still wind up with heart disease because of the way that your body processes what we're eating and what we're doing. But if you're playing the odds, the percentage is way lower if you are healthy and doing the right thing.
So speaking of athletes, I know that particularly in Pensacola, there's a lot of initiative around making sure that in youth athletic physicals we're doing more things
Correct.
like ECG testing. And sometimes I think that maybe we're not communicating necessarily the importance of that and what it is that we're trying to catch early or detect. So maybe you could share some perspective with our audience on that.
So the more you know, the more you know. And as we get smarter and better as a medical professional, and we see the occasional bad things that happen to young people, we tend to pour our time and resources into identifying those. So health physicals are extremely important. And I know that at Baptist, we have a huge team that goes into all kinds of high schools and others to help with this exact problem. But somebody needs to listen to your heart. There are all kinds of murmurs, we call them sounds, that help the medical professional identify something that you might not otherwise have done. Just feeling the pulse. Well, hey, you have an extra beat every once in a while and you're a young, healthy person. we need to look further into that to prevent the bad outcomes and the disasters that are out there, albeit infrequently, but you always want that number to be 0. So those physicals are extremely important to pick up the rare and undetected signs that we know to look for that in your daily life you may not be able to.
So speaking of some of those conditions that maybe people don't know, or sometimes do know that they have, if they had a physician listen to their heart and maybe they detected mitral valve prolapse or something along those lines, would your recommendation be to those individuals who know that they have one of those type of conditions in terms of preventative health and what their habits should look like?
So depending on the problem, whether it's aortic stenosis, mitral valve prolapse, a hole, a foramen ovale it's called, a WPW, an electrical disturbance, those need to be monitored by a cardiologist of some kind. And they will then give you the recommendations as to what you can and can't do, should and shouldn't do, and how often you need to be seen. And typically if you have mitral valve prolapse or you hear a murmur, as you know, most of the time that leads to what we call an echocardiogram or an ultrasound of the heart, where we can identify exactly what it is and if it's really a problem or whether it's, you know what, it's not. But those, all the same preventative measures, but really go see your doctor. And really once you have, from a cardiac standpoint, a known cardiac abnormality, you should be followed by a cardiologist until they tell you, I don't need to see you anymore. I've been doing this for 25 years.
Okay. So I'll go down the rabbit's hole in one last question here, because I think it's another area of potential confusion for people. Oftentimes, they see, the athlete who's touting their resting heart rate. I have, a resting heart rate of 36, a resting heart rate of 40, and I think they're saying that that's a measure of their overall health, but I'm uncertain about that, so I wonder if you could share some insight on that.
So it's a good question. So the answer that I would give you is it is and it isn't. Nothing is black or white, of course. I do believe that the more you condition yourself and the lower your resting heart rate, it is one of the indicators that you are being successful at your level of activity. Does that obviate you from having a problem and saying, well, if my heart rate's 40, I'm good? Of course not. But if you were not used to exercising, or you've been exercising your whole life, and your heart rate's 45, 50, 55, even 60, that is a positive sign without being a lone number to look at. Now, if your resting heart rate is 90, exercise may not fix that, but that is something to take into consideration, that you may need to try and do something to alter that, but it's not a one number take all sort of deal.
Oh, Dr. Ronson, I wonder if you could share with us a little bit more about just signs and symptoms that people should be paying attention to, and then what they should do about some of those signs and symptoms.
So I'm glad you asked that. On our side of the fence, we see all the time missed opportunities, or people that don't really pay attention, and we all get so busy and have so many things that we ignore certain things that are happening and going on. Obviously, the biggest one is chest pain. If you are having chest pain, you have to get that evaluated. Even if you think it's nothing, even if you know you pulled a muscle at the gym, I get it. But short of that, if you are having chest pain, I really encourage you to seek medical professional evaluation. But it's not just the chest pain. It could be arm pain. It could be indigestion or belly pain. We like to say everything from the eyeballs to the knees could be your heart. So really not even just for cardiac disease or vascular disease. If you are experiencing things that are not normal for you, that are slowing you down. Shortness of breath is a classic one. I have patients every day that'll come in and I'll say, "Are you short of breath?" "Well, I'm getting a little short of breath." And their spouse or partner sitting next to them says, "He hadn't been able to breathe for a year." And it goes back to, it's not prevention per se, but it's in the same basket of, you have an opportunity to fix things when your body is telling you something. So I encourage everybody to do that before there's a problem that's much harder to fix.
Maybe we could talk a little bit also about the value of having, a primary care provider, because we know from our last CHNA survey that we're seeing declines, or just not a lot of people in their community that identify a primary care provider. And maybe you could talk about the value of the primary care provider and how that sort of intersects with what you do.
Really, everybody should have a primary care provider that you know. If you are young and healthy and don't have a requirement for a regular visit, you at least need to have somebody who knows your medical history, so that if you do have a problem, a question, a symptom, to go. Everybody, the primary care networks are invaluable. And the more that we can get online and ask the computer questions and get it, it's not the same. I promise. Maybe someday it will be, but currently it is not the same. It is not the same as somebody examining you, listening to your lungs, feeling your lymph nodes. So I think it's a great question. I think it's a huge problem. I think that everybody should have a primary care physician that they can identify with, that you have some relationship with.
And so then that would work as they were having some of those signs and symptoms to go talk with that
Correct.
primary.
You don't have to get over that hurdle of, I have to find somebody to go do this, because that in and of itself can be a big hurdle of, who's taking patients, where can I go, what can I do? And if that's already in place, you are much more likely to seek attention when needed.
So a lot of our students are going to go off and they're going to be physician assistants, or they're going to be in that primary care space, but maybe 5, 10 years down the road from where we are today. And maybe you could comment a little bit on what you think the future holds for them, or what they may be seeing from patients coming in, looking at the trajectory of how things are evolving.
So I think that there are an incredible number of sources for information these days. Patients that come in with preconceived information, our own ability to step outside and Google some symptom, or talk to Grok and they tell you this is what the patient has. And I think that's only going to increase. However, in my opinion, there will not be a substitute anytime soon for a good history and physical. And as much as you can tell the computer what you are feeling, it is not the same as doing an exam and leading questions. So for people that are out in the community, what do you look for? What is it that should prompt you? So what I would say for all healthcare professionals is, if you start saying, well, I'm not really sure, then that prompts more expertise, irrespective of specialty. We all are comfortable with what we're comfortable, but I call consults every day. I ask partners every day. Once you start getting in the uncomfortable feeling that you have, where, they're saying that they're having more chest pain, or I treated this indigestion for a month and it's no better, or wow, I've never heard of that kind of heart racing, slowing. Those prompt, at the very least, discussions with peers or somebody else, or referrals. So from a specific cardiac standpoint, I would say it's a much broader symptom symptomatology that patients present than what we think about. So just have that in the back of your mind if there are risk factors, high blood pressure, diabetes, old age, that just because you think it's their gallbladder, just it may not be. So I would be on the alert for that, and I would encourage any student or practitioner or new practitioner, it's never bad to get a second opinion. It's never bad to call in health. We always have this feel, well, I don't want to really bother them. Well, for the most part, none of us mind being bothered for our expertise.
All right, last question is the magic wand question. So if I gave you a magic wand today and you could wave it and change one thing only about our area that would improve health related to your practice, what would it be?
Obesity, and it's not close. I would figure out a way to have weight loss programs, because those are encompassing a lot of the things that we're talking about that become a byproduct. But weight loss and obesity is, to me, the epidemic in America that people don't really like to talk about as much as we should. I mean, we can talk about eating red meat, doesn't really offend anybody, or eating poorly, it doesn't really offend anybody, but it's a challenging conversation when we talk about weight and weight loss, and I think we need to talk about it more.
Awesome. Well, I want to thank Dr. Ronson for joining us here today, and also thank our partners at Baptist Healthcare for all the good and positive that they bring to our community in providing these type of information and just all the services that they provide. So Dr. Ronson, thank you so much. This has been highly informative, and we look forward to sharing this information with everyone.
I appreciate you having us, I really do.